Okay, sorry. I thought there was 20 minutes of recording. These are only 15 minutes. So let me finish up here with the last few slides. We talked about hearing loss, different types, and again, we'll spend a little more time on this. There's also, when we talk about the time course of the hearing loss, progressive meaning it occurs, but it takes time to occur. Sudden are those people who call and say, last night I could hear fine, and the next morning I went to use the phone, I couldn't hear anything out of my right ear. That's more of a sudden hearing loss. Could be related just to, it can just happen. It's kind of idiopathic. There's no rhyme or reason for it or no known cause. It can be from injury, head trauma, and so forth. So right now, there are lots of people that need SLP and audiology services, and we're kind of in a shortage of particularly audiologists. So when there's a shortage of professionals and a huge need, it's kind of good for the profession as a professional, because you can, if there's only so many practitioners and lots of jobs, you can obviously demand more money and get paid more, which is good. So you don't want an over flooded market where you have so many professionals and not enough jobs. So I mean, it's for us as providers. It's actually kind of a good thing to have a shortage. Now we need to make sure we meet the demand of the patients we serve, because if we don't meet the demand, then it's possible that other professions, like for audiologists, that might be hearing aid dispensers or salespeople, that might meet the demand that we can't meet. So it's kind of a double-edged sword, okay? But again, patients from adults, kids, there's lots of work. That's what that slide says. For school-age children, obviously, we're talking about academics and communication with their peers, education, planning. Some of the services that are needed are educational planning, accommodation in the classroom with assistive technology. A lot of times audiologists will work with students who have hearing aids, and then will fit frequency modulated systems, FM systems, if you've heard of them. And then we also support kids from elementary to secondary to vocational settings. With adults, we support adults and help them continue to make contributions in their workplace, in their communities, whatever is important to them. Okay? Now, evidence-based practice, EBP, you'll hear a lot of people talk about it. It's something that is kind of a hot topic in our field now. And basically, to kind of sum it up quickly, evidence-based practice is making decisions based on evidence. Now, you can't make every clinical decision, based on evidence, because there are times where that evidence might not apply to a particular person. Or, when you do a study, you might find that you saw an effect of whatever you're doing on 7 out of 10 patients. What about those 3 patients that didn't benefit from the effect? So it's basically using research to inform our decision making. Okay. It's not, this is how we've always done it. Okay. And we talk about the EBP triangle. Current best evidence at the top. At the bottom 2 corners, you have clinical expertise and then patient values. And within that, we provide care within those 3 points. Okay. And we'll talk more about that, but that's evidence-based practice, or EBP. So there's different tiers, and I'm going to teach you a little bit about this, and I'll probably give you a little assignment this week on EBP. But there are different levels of evidence, okay, ranging from just a basic, this is my opinion, and I'm an expert, right? So let's say I wrote an article for one of our journals giving my opinion. It's evidence, but it's weak evidence. And then there's, research studies are a little bit higher, better. And then the level 1, or the best evidence, is what we call a meta-analysis. And what a meta-analysis is essentially, if you had, let's say 10 studies, okay? And each study used 10 participants. Individually, you have 10 participants, okay? If you pull all the studies together, you go from having 10 participants each to 100 participants in total. So when you do that, it gives you much more statistical power, meaning that you have more subjects from which to analyze their data, okay? And so a meta-analysis is using statistics on 100 subjects versus an individual study of 10, 10, 10, 10, up to 10 studies with 10 participants, okay? And so I always tell my students, if you find a meta-analysis on a particular topic, like let's say a student is interested in looking at how effective is ginkgo biloba, which was one of those kind of unregulated FDA supplements. How effective is ginkgo biloba on tinnitus suppression or tinnitus reductions in tinnitus? And so if there have been numerous studies, 8 to 10 studies that have all done the same thing, you pull them together, you do stats, and then you figure out, is this an effective treatment? Okay, so we'll talk a little bit more about evidence-based practice, but for now, that should be enough information. So we talked about randomized controlled trials, and basically when you're doing research, you don't want the subject knowledge of what they're doing to affect the outcome. You don't want the experimenter knowledge of what they're studying to affect the outcome. So it's good to do double-blinded studies, which means the person doing the study and the subjects don't know. They're unaware of the purpose and what condition or what drug they're getting. And then randomization is also very important in research. So, if you had, let's say, 100 people who were participating in a study, you might randomly select 50 for one group, let's say a placebo group, where you're just going to give them some kind of placebo sugar pill, whatever. And then you take 50 subjects and you assign them to the experiment group, and so they don't know what group what the group they're assigned to, and they also don't know, the purpose of the study. So randomization is important, and so is blinding. Okay. So let me make sure I'm on the right. Yeah. So when you're engaging in evidence-based practice, many clinicians follow a 5-step approach, and we'll talk a little bit more. But you're basically going to ask a very straightforward question, okay? Does ginkgo biloba work for tinnitus reduction? Then you find the best evidence. Then you assess the evidence, and this is kind of a graduate level thing where you learn more about reading journal articles. I guess some undergraduate programs might teach it, but you learn about reading journal articles, assessing the study design, and all those types of things, and we'll talk more about that. Then you integrate the evidence with your clinical judgment, patient values, your experiences, and then you evaluate the performance of the plan that you develop. So that's it for chapter 1. The rest of the chapters are going to go into all these different components. And we'll just, after we meet about chapter 1 and go over some things, I'm going to give you an assignment for chapter 1. We will start chapter 2. So everybody have a good week, and we'll chat with you on Tuesday.